So, today's topic is pleurisy. Pleurisy is nothing but the inflammation of the pleura. Pleura is the covering or serous covering over the lungs, and there are like two layers of it. There is parietal pleura and visceral pleura. Visceral, very close, immediately next to the lungs, and then you have the parietal pleura. So, pleurisy is nothing but the inflammation, and what happens in pleurisy is the pleura becomes thick and swollen. Between the parietal and visceral pleura, you do have a pleural cavity where type of fluid flows. And then the nerve endings are present only in the parietal pleura. The visceral pleura is devoid of nerves. Therefore, there is no pain when the visceral pleura is affected. But when parietal pleura is affected, there are a lot of nerve endings, and therefore, every time the pleura rubs against the lungs or any other organ, it causes a sharp pain. That is the characteristic of pleurisy. There is going to be sharp pain. So, what are the causes of pleurisy? So, when you take causes for pleurisy, it can be because of infections. So, the infections can be viral infection, bacterial infection like pneumonia, and then URTI is nothing but upper respiratory tract infections, and then TB, and then you have SLE, and then you have RA, that is rheumatoid arthritis, and then even trauma can cause pleurisy, like because of trauma some type of infection or a foreign body gets attached to the pleura, that can eventually lead into an inflammation. And then pulmonary embolism and even cancer of the lungs can also cause pleurisy. So there are types of pleurisy. So when it comes to the types, there is a serous type, then there is a fibrinous type, there is a mixed type which is the serofibrinous type, and then hemorrhagic type where there is going to be an exudate or a hemorrhagic exudate. If it is a serous exudate, then it is serous type. If it is fibrinous, then it's fibrinous, and if it's mixed, it's serofibrinous, and if it's blood, then it's hemorrhagic. So the clinical features, what happens when a patient with pleurisy comes to you, he usually has hypoxemia. So when you check the pulse oximetry, there is going to be very low blood oxygen levels, and then there is going to be pain during inspiration. So because the pleura rub against each other, the lung is expanding, so it is going to rub against the parietal pleura, which will cause a sharp radiating pain. And then there is going to be definitely going to be a chest pain, and then there's going to be fever and chills because it's a type of inflammation, and there's going to be dyspnea, and then the pain radiates to the shoulders and the abdomen. So the pain radiation is going to be to the shoulders. So every time a patient tells you about the pain in the chest along the shoulders and abdomen, then it is definitely going to be pleurisy. And then on auscultation, there is going to be a characteristic stony dull. It is also known as the frictional rub. So there's going to be a type of, like you can hear the rub when you listen to a pleurisy patient's lungs. So it is known as the pleural frictional rub, which is, and on percussion, it's definitely going to be stony dull. And then how do you diagnose? You have to diagnose with a chest x-ray, and then you can do a pleural biopsy to confirm if there is no type of malignancy involved, and you can find if it is what type of it is, if it is serous or hemorrhagic. You can find through biopsy, and then a blood test can be done, and then ECG can also be done. So the next thing is treatment. So you treat the patient's main complaint is definitely going to be pain, because on the lungs rubbing with the pleura, it causes sharp pain, and therefore you're going to give analgesics. So example like ibuprofen, which is an NSAID. And then you can also do thoracocentesis. Thoracocentesis is nothing but draining the fluid. So whatever the fluid is accumulated in the pleural cavity, which is causing this inflammation, which is causing this irritation, it is drained out by the process called thoracocentesis. And then complications. So if it is caused by sepsis, then if it is caused by infection, it can lead to sepsis. and the pain can lead to neurogenic shock, and then or a septic shock, and then it can lead to calcification eventually, because fibrosis eventually, on healing it will lead to calcification. So these are the complications. This is what pleurisy is. Thank you.